Good evening. I'm Dr. Paul Thierman, Director of the Academy Library and its Center for the History of Medicine and Public Health. Welcome to the 15th Annual History of Medicine Night with the theme Health and the Environment, Historical Perspectives. The NYAM Library, as a historical medical library, has for many years partnered with and supported the work of NYAM Section on the history of medicine and public health, providing the materials and services that help foster good historical work. Tonight, we're going to hear 5 excellent presenters and will profit from their efforts. I'm very much looking forward to this evening's program, and I'm glad you've decided to join us. Before we start, though, I'd like to give you a short introduction to the Academy and the library. The New York Academy of Medicine was founded in 1847, so we are now 177 years young. Today, NYAM is a leading voice for innovation in public health, tackling the barriers that prevent everyone from living a healthy life. The Academy Library dates from the very beginning of NYAM. We have since grown into one of the most significant collections in the history of medicine and public health in the country, with books, journals, pamphlets, illustrations, manuscripts, and archives from around the world and across the centuries. We're quite proud that the web publication Secret NYC named us one of the, quote, 10 most beautiful and best libraries in New York City. We invite you to connect with us both digitally and in person, and to learn more, please go to the library page on the NYAM website. I especially invite you to follow us on social media, Facebook, Instagram, and what was formerly known as Twitter. Just search for NYAM History, all one word, on those platforms. To visit us in person, join one of our drop-in tours on the first Monday of the month at noon. The next one is coming up next week on the 4th of March. I would like to let you know 2 further things, please. You may turn on closed captioning for this event, and you may pose questions for our speakers in the Zoom chat feature, which we'll address after each presentation. I very much look forward to hearing what everyone has to say. Finally, please be on the lookout for a note announcing the video of tonight's event. I hope you will join us for future NYAM offerings as we seek to understand and address the challenges that prevent everyone from living a healthy life. For the library's next event, we're screening a film on April 18th in connection with Earth Day. So thank you. And I now pass the virtual podium on to Dr. Robert Rubin, Chair of NYAM's Fellows Section on the History of Medicine and Public Health.
I see that the President of the Academy, Dr. Kurth, has joined us, so let me turn over the podium to Anne. Anne, you're on.
A pleasure to have everyone here tonight. Thank you for taking the time. We're extraordinarily proud of our library and the seed source of human clinical knowledge that it embodies, and how we can draw from that to have lessons applicable to the current clinical, public health, and social challenges that face us, including around health equity and the environment. And so really appreciate the topics and everyone who's put this together, including on the committee. So thank you. Thanks, Bob.
Thank you, Anne. Well, this evening we're in for 5 very interesting papers, 2 presented by physicians, and the other 3 presented by undergraduates, graduate students, and medical students. I feel quite fortunate and really delighted for such a wonderful group of presenters. So our first presentation will be by Dr. John Harris, entitled How New York City Got Its Street Trees, a Public Health Story. You're on, John.
Okay, good evening, everyone. Give me a second to get this show on the road. Okay. There we are. Okay. And turn that off. Okay. Tonight I'm going to briefly tell you, let's make sure everybody's hearing me okay. Yes, tonight I'm going to briefly tell you how public health brought trees to New York City streets. Here's an example of what happened. This is Pitt Street at Rivington in the Lower East Side. The photo on the left was from 1909. The picture on the right is the same intersection last September. Over those 114 years, Manhattan added 50,000 street trees in the name of public health. But first, this brief commercial message. This story is about a New York doctor, Stephen Smith, and it's lifted from my biography of Dr. Smith published last year. Aside from the obvious self-serving reasons for mentioning the book, I want to acknowledge that I was immensely aided by the New York Academy of Medicine's library, particularly your research librarian, Arlene Shaner. Now, to those of you who might not be familiar with this particular Stephen Smith, here's a brief summary. Stephen Smith was the one for whom the Academy's Medal for Lifetime Achievement in Public Health is named. He was born in New York's Finger Lake region in 1823 and died there in 1922. He was an accomplished New York City surgeon, a founding father of American public health, and a lot more. For me, the only American physician with a comparably broad public presence was probably not as good a doctor, was Benjamin Rush. Smith ran a mammoth sanitary survey of Manhattan in 1864 that led to the first real city health department in the U.S. in 1866. He was a New York City Health Commissioner from 1868 to 1875. He founded the American Public Health Association in 1872, served as its first president for 3 years. He helped start the National Board of Health and served on it for 5 years. He single-handedly ran New York State Asylum System from 1882 to 1888 and served as commissioner on the powerful State Board of Charities for 30 years from 1888 to 1918. Smith authored or co-authored several laws, among them the ones creating the New York State Board of Health and the State Lunacy Commission, and another law we'll talk about in a minute. In total, this guy was appointed by 3 mayors, 7 governors, and 2 U.S. presidents to 50 years of public service. So now that you have the big picture, let's talk about trees. Stephen Smith was one of 4 health commissioners on the New York City Board of Health in 1872. He had been a member of the board and its predecessor, the Metropolitan Board of Health, since 1868. And much of the board's work dealt with sanitation. But in 1872, the board asked Dr. Smith to report on the long-observed summer increase in death rates. Smith sent a 29-page report in April of the following year, shown here on the left. And his principal conclusion was that heat was the summer killer. And it was a conclusion not too different from today, that hot weather is bad for people, and it's likely to be a bigger problem in urban areas. On the right is Smith's official photo as president of the American Public Health Association in 1872. And if you ever wanted to see a picture of a literal heat island, here was Manhattan in 1873. Wall-to-wall buildings, only 2 decent-sized parks, the Battery at the Tip and Central Park in Midtown, with hardly a speck of foliage or a breath of fresh air anywhere else. So in his 1873 report, Smith described the direct effects of heat on animal and human physiology. He showed correlations between temperature and mortality, which are shown here. He explained how heat reduced resistance to diseases and exacerbated indoor pollution. He argued that urbanization had made Manhattan hotter than surrounding areas, and the situation was only going to get worse. The bottom image shows his heat island argument in 1873. It has, it being Manhattan, a southern exposure below 59th Street. Almost the entire surface is stone and brick. It's destitute of vegetation. Its buildings are irregularly arranged but crowded together so as to give the largest amount of elevation with the least superficial area, and so on. He didn't use the 20th century term heat island, but he made exactly that point. Smith's primary solution to Manhattan's urban heat problem was more shade trees in the streets. He presented considerable data on the heat mitigating properties of trees beyond providing shade, such as moisture retention and dispersion. And as you can see here, he also described how trees reduce atmospheric toxins, including carbon dioxide. Knowing how things got done in New York City, he did not expect voluntary or private efforts to accomplish anything for public health, nor did he expect urbanization to slow down. For Smith, the Parks Department needed to take on the street tree planting job in the name of public health. But Tammany Hall, as most of you probably know, Tammany Hall pretty much controlled city politics and its streets, meaning nothing got done with Smith's 1873 report. He left New York City's public health in 1875, tackling national issues on the National Board of Health. Then in 1872, he turned his energies to mental health. Things only got worse for the city's trees. This scene shows construction of a never finished cable car route on Broadway in 1891. And this kind of digging was going on all over the city. The trees you see here were mainly a construction nuisance. Nobody cared what tearing up the ground did to their roots. By the turn of the century, New York City was losing far more street trees than individual residents were planting. And planting trees was very much not the city's concern. But Smith still lived in hot Manhattan when a group of well-known citizens formed a tree planting association in 1896. He signed on, even though this was the kind of voluntary effort that Smith knew wouldn't work. But it became his tree planting platform. In 1899, he leveraged the Tree Planting Association to regulate street trees, moving tree planting and maintenance from the public to the government, as he wanted in 1873. Smith's bill passed the 1899 legislature, but Mayor Van Wyck from Tammany Hall vetoed it. The letter to the Times on the right was from the Tree Planting Association's landscape architect, John Collier, in 1900, confirming that Smith had written that sabotaged bill. Smith's public health experience had taught him that policy change takes multiple tries and multiple approaches. That same year, 1899, he dusted off his 1873 Board of Health report and rewrote it for Appleton's Popular Science Monthly as Vegetation, a remedy for the summer heat of cities. This particular article was a genuine masterpiece of accessible science. It became a manifesto for the street tree movement, and it's still readable today. Another Dr. Smith, William H., who's an environmentalist, actually cited this article in 1977 when making exactly the same arguments. Smith finally got his law when New York City elected a new mayor in 1902. Note the title of the law, which is shown on the left, an act to extend the jurisdiction of the Park Board of the City of New York to the preservation, planting, and cultivation of trees and vegetation in the streets thereof for the purpose of improving the public health. One of the law's key features was the establishment of a Bureau of Tree Culture within the Parks Department. Another was that all city trees not on private property were now city property managed by the Parks Department, and damaging a tree was a misdemeanor. And on the right, you can see it once again, John Collier made sure Smith received the credit. And once again, nothing got done. The problem was that the Parks Department president, Charles Stover, really appreciated trees, but only in parks, not on city streets. And in his world, trees on streets were more of a nuisance. This is from his 1911 annual report. The desire to maintain trees on the streets in business or residential sections is scarcely ever found. Manhattan continued to lose more street trees than its citizens planted. But in 1911, 88-year-old Stephen Smith becomes president of the Tree Planting Association and raised a ruckus. Here's one example from the Sunday New York Times in 1911. And in 1913, his public health marketing skills really kicked into high gear. And that's because the Parks Department had a new president who was more sympathetic to street trees. Smith was still president of the Tree Planting Association. He contacted the new State College of Forestry at Syracuse about doing the first ever tree census in Manhattan. He announced this census early in 1914 in a pretty splashy piece in the New York Times. And you can see Dr. Smith's picture right in the center of this New York Times article. Then Smith gave the Parks Department new president, Cabot Ward, the ammunition he needed. Ward was a planner who loved detail. Smith sent him a comprehensive plan for the still non-existent Bureau of Tree Culture in March 1914, complete with job descriptions and a budget, and reportedly signed off by Hugh Baker, the young dean of the State College of Forestry, and he made sure that the papers knew this. And Smith peppered the Times with letters and press releases. He announced that his tree survey, which had not really begun, was actually finished and on its way to the Park Board. Syracuse eventually, towards the end of that year, sent him a 21-page report in December, which was not a tree census, but in good consultant fashion was a reiteration of everything Smith had been saying. The message from the College of Forestry was that New York City was making a serious mess with its street trees and would soon have none. And at this point, Smith's 40 years of street tree work was over. Well, what happened next? The Parks Department President, Kevin Ward, asked Syracuse for a bigger report, which he got in 1915 using Rockefeller money. Lori Cox from Syracuse did a real 89-page tree census and showed that Manhattan had at its best 15,000 mostly unhealthy street trees, but could support as many as 25,000. Cox outlined everything the city needed, what, where, and how to plant street trees, and this was enough. Things slowed down during the war, but by 1927, the Parks Department had Smith's Forestry Bureau in place and estimated that Manhattan had 17,000 trees. Where are we today? Manhattan now has about 65,000 street trees, and the entire city has almost 600,000. What you see in front of you is often quoted 2007 estimate from the Parks Department, counted $5.60 in benefits for every dollar invested, from things like pollution removal, stormwater capture, and although it's not shown here, property value enhancements. Like most everywhere else, there was no attempt in this report to quantify the public health benefits of street trees. New York street tree arguments today, again, as most everywhere, are about environmental economics, not public health. And it's not that public health is ignored. This article shows there's just so few good data. This 2017 article observed correctly that public health benefits are simply less intuitive than biophysical benefits and harder to quantify. And the likely result of failing to consider public health when addressing urban forestry is underinvestment and misallocation of the investment we do make. Which kind of brings us to the messages of my story. Well, for one, Stephen Smith, 1873 public health arguments for urban reforestation are stronger than ever, but we could use more research. Here's a 2021 article from the Lancet reminding again that heat stress kills and trees are a better way to deal with urban heat than air conditioning and waiting for global warming to stop. But I suppose another message, as Smith well knew and demonstrated, is that it takes persistence, data, and multiple approaches to get things done in public. So I will be glad to take questions for the next couple of minutes. Anybody?
Thank you. Yeah. This really was an interesting one. There are no, if you have questions, please put them in the chat. And just there, I would ask the question, John, concerns validation. Has anybody taken a look at morbidity, mortality, and correlated that with the number of trees within the district?
I'm so glad you asked that question, Bob. No in Manhattan, yes in Sacramento. Very small amount of Sacramento, for those of you on the East Coast, has probably more trees per person than any place. They proudly call themselves a tree city. But there has been done some research, and I believe out of UC Davis, looking at, and it's just kind of cross-sectional epidemiology, looking at areas that have more trees and then adjusting for demographics and anything you can think of, and comparing mortality rates with areas within that same area that have fewer trees. You can definitely document lower amounts of certain respiratory illnesses, and you have some sense of better mortality. But for the most part, that kind of work still needs to be done.
There's a question in the chat from Cassandra. Does the type of tree matter for public health benefit?
Yes. For a couple of reasons, which Lori Cox pointed out in his report. First of all, you need trees that can live in city environments, and that's not every tree. But secondly, you have trees that sometimes secrete or excrete terpenes and other volatiles. So you've got trees between pollen and terpenes that can be actually dangerous for health. So yes, the type of tree matters. You need trees that absorb environmental toxins that can handle life on the city street and don't, in some ways, actually make things worse.
We have one final question in the chat from William to host and panelists. Stories often motivate people to do things. Do you have any thoughts on the effect of a tree grows in Brooklyn on public attitudes?
That's more of a sociological story than an environmental forestry story, but I suppose it helps kind of subtly make the point.
I've one final question. We're living in a time of substantive climate change, despite some, ostriches. Has the Parks Department looked at the effect of climate change on the present group of trees and what new trees may be needed to meet it?
Interesting question. Most of this work is not done, as I said, in public health, but done by forestry people.
Okay,
Forest Department, if they have, I haven't seen them publish anything, but you will see stuff in the forestry literature kind of somewhat addressing climate change, but I haven't seen much that says, well, climates are changing, you need to rethink the kind of trees that you're planting. I wouldn't be surprised if it's out there though.
well, thank you very much for an interesting talk. Our next talk is by Ashika Hazikara, who is a PhD student, and it's entitled T. Cordon Santere, Native Body and Medicine, Climate and Health in British India. You're on.
Yeah. Good evening. I am just sharing my screen. Yeah. All right. My topic is on medicine in British tea gardens of Assam between 1840s to 1940s, which represented a distinct medical enclave where a sanitary cordon where the practice of a specific kind of medicine was privileged. This medicine is representative of what is now seen as the trope of tropical medicine, which is based on the idea that the tropics or warmer climates are epidemiologically distinct. This trope can be traced to the epidemiological transition of 1490 to 1840, arguably the Great Escape or the age of receding pandemics when mortality from typhus and plague was greatly reduced. It brought about two developments. First, it pioneered the progress towards a public health movement. In 1772, John Pringle of the Royal Society in England strongly advocated for sanitation, personal hygiene, ventilation, and landscape drainage as means of disease control. This was taken up more concretely by Edwin Chadwick, who headed the Board of Commissioners of the New Poor Law, the department in charge of sanitation in England at this time. Like Pringle, Chadwick's idea of disease control, or really the control of miasma, was centered on the management of sewerage, water supply, and drainage. So the second development, the idea that the environment was a source of disease, was greatly derived from this miasma theory. Second, this idea of the epidemiological distinction of the tropics, or the idea that the tropics had certain specific diseases, was reinforced by the Liverpool and London Schools of Tropical Medicine and the British Journal of Tropical Medicine. Moving to slide 3. This is a 1905 copy of the British Journal of Tropical Medicine. On the right side is, on the right side is a page from this 1905 copy where the epidemiology of plague is discussed in the tropics, quote unquote tropics, in this case, India. Moving back to slide 2. This trope also essentialized polarities of quote-unquote backward disease tropics of the ruled against quote-unquote modern sanitized Europe of the rulers. And this can be seen as the beginning of colonial medical interventions, which were rationalized, and I'm quoting from David Arnold, the progress towards a more civilized social and environmental order. Now moving to slide 4. In British India, this trope took the form of an enclavist medicine, which prioritized what is called the colonial enclave, or spaces of colonial habitation, productivity, and power, such as the cantonments, the prisons, and plantations. And in this, quote unquote, the native body became a site of medical experimentation. I have examples from 3 erstwhile British provinces. In India, the Bengal Presidency, the Bombay Presidency, and Punjab. I am going to quickly read out the examples. In 1893, at Gaya Jail in Bihar, bacteriologist Waldemar Haffkine inoculated 215 prisoners against cholera, and in 1897 inoculated almost half of the inmates of Bombay's House of Correction with his anti-plague serum. Similarly, in 1907, G.F.W. Braid, Inspector General of Prisons in Punjab, directed jail superintendents to give weekly doses of quinine to prisoners to test the efficacy of quinine against malaria. I'm working on similar examples in the case of British tea gardens of Assam. Now, moving to slide 5. A major factor that contributed to the medical distinctiveness of the tea gardens was the tea environment, or the tea microclimate, brought about by huge forest clearances to build these tea gardens, which weakened the soil structure, and all of which collectively made these tea gardens more susceptible to malarial Anopheles mosquitoes and also tea bugs and tea mites. On slide 6 is a sketch of the tea mite, or the red spider, by J. Wood Mason, who was the deputy superintendent of the Indian Museum in Calcutta at the time. Now, going back to slide 5, malaria continued to be a major cause of death in these plantations. Between 1877 and 1920, on average, 1/10 of deaths were caused by malaria. Anti-malarial sanitation, especially the use of quinine, became a priority in these tea gardens. Also, anti-malarial surveys were prioritized. This is an example of an anti-malarial survey, the report on malaria in the Assam tea gardens by C. Strickland of the School of Tropical Medicine and Hygiene in Calcutta. The page on the right is a page from this report, which discusses the ecological reasons for Assam's susceptibility to malaria. Now, moving to slide 8. We find the evidence of the large-scale use of quinine from government reports such as the annual sanitary report of the province of Assam and the annual public report of the province of Assam, which have multiple publications. These are 2 covers. The first is the 1902 cover sanitary report cover, and the second is the 1944 public health report cover. Now, moving to slide 9. Alongside quinine, other forms of anti-malarial sanitation efforts included the improvement of tanks, drains, and wells, and the setting up of malaria brigades, which were funded by both private donations and also town improvement funds. I will quickly move to slide 10, and then I'll go back to slide 9. So there was a change in the usage of quinine over the years, and we have this. This is a page from the Sanitary Report 1922. There was a decrease in the use of quinine to 10,609 in 1992 from 12,616 in 1921. This decrease was because of a rise in the price of quinine. At this time, the seller of quinine to the province of Assam was the Bengal Presidency, which had raised the price of quinine largely because of a perennial shortage of quinine. I'm moving to slide 11. Because of this shortage in 1933, quinine reinforced cinchona febrifuge, which was 1 part of quinine to 3 parts of cinchona, was sanctioned. Till then, the sale of quinine remained low. In 1944, there was an increase in the rise of malaria mortality, and followed by a huge shortage of quinine, and even the new cinchona febrifuge tablets, so other types of anti-malarial drugs like napacrine had to be distributed. And I'm moving to slide 12. This is my last slide. The table records the distribution of quinine and other secondary alkaloids in 1944 by the medical department, the public health department, the jail department, the police, and Assam Rifles hospitals. And this kind of shows that how quinine and derivations of quinine continue to be a priority in the tea gardens. To conclude, this ongoing project on medicine and public health efforts in British tea gardens of Assam, a case which is complicated by ecology, is relevant because it does tell a lot about the very workings of the British Empire. And through these questions and also new questions of the medical role of Christian missionaries and the diet and medical regime in these tea gardens, my aim is to add to the broader question of public health and climate in British India. Thank you.
Thank you very much. Do we have any questions for Shikha? Nothing in the Zoom, in the chat. I had one observation. In one of your earliest slides, you noted that there were some human experimentation. What about the ethics of that? Even though we're looking through, the optics of sensory difference, that there was, prisoners were given without probably their consent. Some were given the disease, some weren't. Some were given controls. Do you wish to comment on that?
Right. I mean, it's kind of a difficult question, given that this question of consent, non-consensual, when it comes to this dispensation of medicine, it's difficult, but I'm trying to find parallels in the case of plantations, and because this is a more familiar area for me than, say, prison. So I feel like I'll have more clarity as I progress with this project about this question of consent.
Yeah, well, it's reminiscent of certainly what happened here in the United States, the classic things like the Tuskegee, and it seems to be on a pretty large scale. I think that might be an interesting sidetrack to go into.
Right.
What is your feelings? Whoops, we have anything? Oh, we have a question in the chat. Okay. We just, yes, to you, Cassandra. Should we use data from trials without consent?
Okay. Trials without consent.
This was an important question because this refers to what happened in World War II.
Right.
Seen, the bodies of people in concentration camps to promote anatomical diagrams, to look at experiments on people to see what stress would kill them or not kill them. So this goes right back to there.
Right. Yeah. Yeah. I've never really thought about this question, but this concern about certain medical documents being sensitive is obviously a concern. So ethical kind of accumulation of data, especially when it comes to anything on medical histories, should be prioritized. And I feel it is kind of a larger responsibility for some documents to be kind of censored, but I'm not sure how far would that extend to trials in prisons, but this is an important question.
It is. That's troubling. And thank you for a very interesting exposition to see what was happening in India at that time. Our next essayist is Dr. Richard Kahn, and the title of his is Noel Webster, Epidemiologists Revisit, the Publications of a Brief History of Epidemic and Prastinian Diseases, 1799. It's all yours, Richard.
Well, thank you. I'll be talking about two two books that Webster, this is Noah Webster, Dictionary Webster, published 1796 and 1799, and the missing author's review copy that I found in the bowels of New York Public Library. Webster instigated the medical repository, the first U.S. medical journal, in 1797. So the publication of these two books, why, how, and where he gathered the information and the content. I don't know why I'm getting this. The content, authority, and criticism and influence of his medical books. I argue that Noah Webster's writings and historical epidemiology made a significant contribution. My video is on. Do you not? Can you not see my video? It says I'm screen sharing.
It's there. I have it. Yeah,
Okay,
I have it.
okay.
Climate focus and history of medicine, et cetera, et cetera, et cetera.
Okay, well, Webster influenced Benjamin Rush, Priestley, and others more than I think has been appreciated by later writers evaluating Webster's contribution. And his extensive data collection emphasized the relationship between cosmic and environmental factors. He emphasized epidemic constitution of Hippocrates and Sydenham exhorts physicians to appreciate the influence of the environment and season on health and disease. Hippocrates used the term catastasis. It can be, you can put the emphasis on either syllable, that translates into constitution. New York Academy of Medicine's Iago Galston 80 years ago explained catastasis of Hippocrates was for a while forgotten, and it was the end of the 18th century. It was re-emphasized by people pursuing historical epidemiology such as Noah Webster. Webster's life, there was a spelling life, 1783, a speller that was so important, American nationalism. His medical life was predominantly writing in the 1790s to 1800, but I'll touch on 1832. He felt it was a domestic, he felt yellow fever was a domestic problem. We need to clean up the slums, water, and seaports. And then his dictionary life was after 1800. So yellow fever there were yellow fever epidemics during the beginning, first half of this 18th century, but they certainly increased during the second half. Let's go to 1795, New York. And there was no medical journal, U.S. medical journal. And Webster sent this circular to physicians up and down the coast. Tell me what's going on and I will publish it. At the time, he was editor of a newspaper. He sent this, he did get replies, and he published a collection of papers on bilious fever, that's yellow fever, in 1796. And in it, he said, I'm not going to continue this work. I can't. That was dated July 1st, 1796. 6 weeks later, a young New York physician and fellow Connecticut Yaley wrote in his diary, I think as Mr. Webster has relinquished his plan of continuing his collection, of taking it up myself. And 11 months later, the medical repository was born, and Smith was one of the editors. A lot of people weren't happy about Webster delving into medicine. He had political and medical opposition. This particular slide talks about the political opposition. He was a Federalist. Well, the anti-Federalist Benjamin Franklin Bach, an editor in Philadelphia, grandson of Ben Franklin, wrote a pretty nasty article about Webster. This is about Webster's circular asking for information, and it starts, Noah Webster, author and physician general of the United States. So he published his book in 1796. There were 5 anti-contagionists, 1 contagionist, and 2 it wasn't clear what they were pushing, but this is what he published. And then again in July 1797, the medical repository that he stimulated, and it was the first serious attempt in this country to present the relationship between science and practice in a serial format that allowed response and communication. And I thank Arlene Schenner for her help getting the wrapper. This is the wrapper that was sent out when each issue was sent out. I couldn't find it. I looked for years, but thank you, Arlene. Webster was one of the original subscribers to the medical repository, and he lived on Pine Street, just 1 block off Wall Street. He published in the end of 1797. He published 25 letters in his newspapers, refuting Dr. William Curry, who believed that it was the problem was contagion and quarantine was the answer. Each letter was read by Smith before publication. I'll just read part of one of them. This is 1797, tracing our epidemics to some distant region. The Greeks and Romans blamed the plague on God. Mohammedans ascribe it to fate. Americans charge it to West Indies. The English blame Egypt. The French blame Constantinople. You get the idea. Rush wrote to Webster, and other people wrote him, that this should be published, and he did. He published it in December of 1799, those letters, but he added more than doubled the information, and the Hartford edition was 1799. This is the title page of volume 1, and these are the two tables of contents. And I just mentioned venesection, the lower part of the right. He did not believe that venesection, bloodletting, was useful, and his friends, including Rush and Smith and others, couldn't convince him. And in this book, he cites 12 authors, 16th and 17th century, that he agreed with. And then I just point out the vapor and mephitic air. He was curious. Webster was always curious about things. He was counting. He was trying to learn and teach. So here he is. There's Pine Street, City Hall on Wall Street. And on the 30th of August, 1795, yellow fever had just attacked New York. 2 men fell, and this is Webster's writing, 2 men fell victim to the vapor in the well belonging to a brewery in Pine Street, a few yards from Webster's house. It was 25 to 30 feet deep. It contained a few feet of water and had been unused and covered with boards. It was so full of vapor. So this is his experiment. He put a lit candle down there, and within 8 feet of the surface, the candle went out, showing, obviously, it was mephitic air, poison air. This is the 21st century explanation of why the candle would go out, but Webster didn't know that. But he asked, this was during the sickness, during the yellow fever, and questions whether the two are related as far as cost. He looked at the bills of mortality, and he found difficulty comparing it. For example, Philadelphia, the bills of mortality went from August to August, and New York from January to January. So trying to compare them. So where did he go to gather his information? He went to his alma mater at Yale. He went to Harvard College, the Loganian Library in Philadelphia, and the Public Library in New York. That got me for a little while. This is 1790s we're talking about. These are college library catalogs before 1800. Harvard had most books, but only half of them were theology and only about 9% science. He may have had better luck at the Loganian Library in Philadelphia. That became part of the Library Company of Philadelphia. And James Logan's brother, William, donated a 1,300-volume medical library to that library. And it was perhaps the best medical library in North America, according to Edwin Wolfe. But the New York Public Library was founded in 1795, so it couldn't have been that library. And what it was the Society Library that began in 1754 and was housed in the City Hall. In fact, specifically upstairs, the northeast corner, that's where it was. So there, it was renamed the Federal Hall in 1789. And here's another view. It was renamed Federal Hall. There's Trinity Church at the end, and that's where the library was. But in 1795, the library moved 2 blocks down Nassau Street, and I think this is where Webster would have been doing his research, the New York Society Library. He complained that no man can find in this country all the books necessary for a complete examination of a historical and scientific subject. He requested epidemiologic data from all sorts of people. He apologized for the hundreds of references that might otherwise appear to like affectation. But he had to convince everybody that he was doing a serious job, particularly physicians. He's a non-physician writing about epidemic disease. He was going to get flack. He analysis of the diverse opinions of earlier writers. It was this is volume 1, chronological and historical view of various epidemics. And the last part, 1788 to 1799, is a time when Webster was around, and he could even do a little contact tracing, and he did. It showed volume 2, statistics and bills of mortality. Webster defined specific contagion as a quality of disease which can transmit under all circumstances, season, weather, situation. And you can see how yellow fever was a little bit different. I mean, it would disappear with the first frost. What's with that? Smallpox, measles, didn't know about frost. It would go all year round. There was something different about it. So there was the relative importance of the epidemic constitution, the atmosphere, the weather, and various pollutants, decomposing organic material. And that Hippocrates and Sydenham talked, Webster, clean up the cities. That's what needed. Contagion, what needed to happen was quarantine. He thought that the electrical principle might influence epidemic. Why is 1 year bad? Think of Franklin. He knew Franklin, Volta and Galvani in the 1780s, trying to think outside the box. What might explain this? He discussed quarantine as almost complete failure. Science was beginning to supplant the words of Hippocrates and Galen. The authority of antiquity was failing. It was an epistemic crisis. They were talking past each other. He felt that the pestilential fevers were greatly increased by the morbid exhalation of cities. There was something about cities that made things worse. Personal hygiene and public sanitation might help. And he wrote, though, not a physician, I am accustomed to philosophical inquiries. He had published 13 books on various topics. He lectured around. He was quite well known in the 1790s. So what about his influence on Rush? April 1799, he said, Rush said, I subscribe to your inflammatory constitution. February 1799, February 20th, he said, Caldwell adopts and supports all of Webster's idea in the subject. March of 1799, this is still, 9 months before the book was published, A Brief History of Epidemic and Pestilential Disease. He said, I have prepared my class of 100 pupils to receive and read it. Webster had sent Rush a manuscript to read, and Rush wrote, this manuscript has arranged my free-floating and half-connected ideas upon the subject of epidemics. Rush even did there was no index, unfortunately. Rush wrote an index in his copy. But in 1805 and 1809 editions of Rush's major book, Medical Inquiries, he wrote, I've relinquished my opinion that he had previously, 1793, 94, 97, respecting contagious nature. He thought that yellow fever was highly contagious. And then he wrote, in 1805 and after, for the change of opinion, I am indebted to Mr. Caldwell and Mr. Webster's publication on the subject. What about this missing copy? Well, I had read everything I can get my hands on, and then I read the bibliography, 655 pages. There were 2 lines in it, said Webster. There's a copy at New York Public Library of Webster's with manuscript corrections and revisions. I'd never seen anything, couldn't find it in Catnip. And when I went to New York Public Library, Rare Books, they couldn't find it either. They said, we don't have it. And I said, I think you do. And I showed her the page in the bibliography. An hour later, they came up with it. It never made it to the electronic catalog, or hadn't then. He did the corrections. They were made after 1827 because you notice he wrote, I'm a member of the American Philosophical Society, and I checked with them. He became a member in 1827. Why did he consider revision after 30 years? My hypothesis was cholera, and that's what it proved to be. The cholera was going around the world, and that's why he was going to do a new edition. what were the changes in this? He mellowed as a reformer at 74. It is a crime becomes not to be accepted. He deleted the avarice of the original proprietors that he wrote in at age 41 in 1799. Oliver Wendell Holmes wrote 50 years later, it's a fact that most writers get tired of finding fault about the time when they're growing old. So maybe he was getting old. Medical theory changes were crossed out throughout these, both volumes. Reference to electricity was removed. Brown, lots was removed. But this is my favorite, spelling reform. So here he's been working 25 years on this dictionary, and here he is correcting both volumes, his own spelling from 30 years earlier, from all of his revisions. Daniel Drake in 1832 suggested that he give a new and revised edition. So finally, his no new principles. His emphasis was on the factor of epidemic constitution. 50 years later, Clobet at the first sanitary conference said that epidemics are always cosmic conditions. He hypothesized the electrical, chemical properties. He influenced Rush, and finally, he advocated a systemic collection of disease data. 1799, he petitioned Congress. It did happen, but it took 50 years. So his two books made a significant, and letters made a significant contribution. And in 1936, Richard Shryack wrote that it was his private opinion that when Webster turned to lexicography, he was a good epidemiologist gone wrong. Thank you, and thank all the libraries and librarians who have helped me through the years.
Okay,
Thank you, and if you have
very much.
questions, I'd be glad to answer.
We have nothing in the chat. I would just mention that, perhaps, hold on, we have something in the chat. Was from Alessandra. Was Webster more a proponent of disease spread through miasma theory or poverty-stricken urban centers? Very good question.
I think it's a good question, and I think it was both. He did realize, and in my paper, the book I'm working on, I wrote that it was areas of poverty that people couldn't move out if there was an epidemic. New York, anybody with money left. They went upstate or went someplace else, but those people could not leave. But it was still miasma. It wasn't obviously not bacterial, but he was trying to explain the unexplainable, trying to think outside the box. And I think he did his writing is very interesting. He also, by the way, talked about how important it was having wide streets and trees. We're talking about Philadelphia. Rush did, excuse me.
Yeah, I think something too, we have the Decameron, which is another example of this, but I think also is quite true. Correlation is not necessarily causation.
Exactly. I have, I'm in my paper, post hoc fallacy and confirmation bias. I mean, that's what the whole thing is about.
Okay, thank you very much. Our next panelist is Alessandra Papaalod, who is a Yale undergraduate, and her essay tonight is Grassroots in the Great Lakes, an exploration of Anishinaabe organization against environment and public health injustice across the Great Lakes of the United States. Alessandra, take it away.
Thank you very much. I'm going to get my slides up. Okay, great. Hi, everyone. My name is Alessandra. I'm a student at Yale University, and I am so excited to be sharing a historical research project that I did for one of my classes on grassroots movements in the Great Lakes. More specifically, I evaluated how grassroots organizations led by the Anishinaabe people of this region promoted environmental and public health reforms. So just to give a little bit of context, let's talk a bit about grassroots movements, which are often smaller uprisings from bottom-up perspectives. Whereas legislative endeavors aren't always able to encapsulate the gravity of a situation and its effects on a certain people, local level involvement is wonderful because it considers the perspectives of those directly affected by a given conflict. I chose to look at the Anishinaabe organizations because I feel that they exemplify the true impact of grassroots initiatives, particularly addressing injustices that occur between the government and Native peoples. These issues, I acknowledge, are currently ongoing for many Indigenous communities, but if you'll bear with me, I'd like to take you all on a blast to the past. Let's talk about the history of the Anishinaabe people. Who were they? They live in the Great Lakes, sure, but what were they all about? So, this group encompasses clans in both the United States and Canada, like the Chippewa, the Algonquin, and the Potawatomi. Like a number of native tribes, the Anishinaabe have a traditional relationship with the earth, but being centered around the Great Lakes, these groups place an even heavier emphasis on honoring their environment. However, things changed upon European colonization efforts in the 1800s, and what initially started as endeavors to expand French and British and eventually American territories both stripped these people of much of their lands and laid the foundation for environmental injustices that continue to endure today. So let's talk about this colonization. As the New World was colonized, a symbiotic relationship between European fur traders and Great Lakes natives formed. These Europeans, particularly French colonists, relied on the Anishinaabe for their natural resources and their knowledge of the area. The Europeans were absolutely entranced with the Great Lakes, and we've romanticized this a lot in our history textbooks for centuries. There's a lot of rhetoric out there that exists on these good relationships with settlers, natives, and the environment, and even Richard Nixon noted in 1972 that the region represented boundless promise and territorial grounds for the future. Though you might expect most of this to have been falsified, relationships between these indigenous people and the Europeans were actually pretty decent. So good, in fact, that the Anishinaabe tribes actually fought with the French against other indigenous people in the French and Indian War. However, as some of you may remember from your US history classes, as North American colonialism became pervasive throughout the 18th and 19th centuries, these relationships soured. They soured from a legislative angle. The Anishinaabes' territorial ownership dwindled as a result of a shift by the American government towards land development, with a significant toll on the tribe's cultural and environmental rights. By the 1900s, many Native Americans across the United States had been confined to the poor conditions of reservations, and this is what things began to look like. As shown here on the left, treaty after treaty removed a considerable amount of land, and by the mid-1800s, and that quantity only grew by the end of the 19th century, where we can see that quite a bit of land had been ceded by the Anishinaabe. You might ask, why did this happen? What was the US government's interest here, right? Well, at this time in American history, growing lumber and mining companies were of value, and US officials allowed the land to be decimated for resources. They saw it as an opportunity cost of sorts. Conditions worsened as reservations were officially constructed in 1851 by Congress, a direct attack to suppress the voices of the Native people. But governmental failure to indigenous groups extended beyond the 1800s. So the developing mining and construction activities that I mentioned before, yeah, those industries began to pollute the Great Lakes water system and rightly received criticism for it. So at that point, enter the government with the 1972 Water Quality Agreement between the US and Canada. Now, Richard Nixon over here considered himself to be quite the champion of the indigenous people, so it was certainly curious that this agreement made little acknowledgement of the Anishinaabe people in its clauses, only focusing broadly on all Americans and all Canadians. I should also note that the board of this agreement also failed to include an indigenous person until 2012, proving that though the agreement itself was effective in establishing international goals, systemic injustices can continue despite improved legislation. So I want to focus in on this time period a little more, looking at specific actors and organizations. Setting ourselves in the context of the 1970s is where we begin to see the rise of grassroots environmental activism, especially in light of movements sparked by the likes of Rachel Carson and Ralph Nader, and the background of the rising American Indian movement. I'd like to spotlight one group specifically, Women of All Red Nations, or WARN. WARN was established in 1974 to combat a variety of different Indigenous injustices, particularly environmentalism. WARN rallies frequently, as shown down here, but they're also known for researching associations between uranium mining on native lands and sudden instances of serious health complications throughout the 70s and the 80s. They presented a report called The Theft of Life to Congress in 1979, excuse me, trying to get this mining to stop. And guess what? It actually worked. Warren gained Congress's sympathy for reparations toward the Great Lakes, and previous governmental legislation had been unable to stop these consequences of mining culture. But through fieldwork and lobbying and being loud, one group transformed a lot of change. Moving on to the 80s, I'm going to spotlight Gudsy Cook, who is not a member of any Anishinaabe tribe. She was a member of the Mohawk tribe, but her work was incredibly important to the ongoing disputes in the Great Lakes. So she began researching maternal health effects of pollution, forming the Mother's Milk Project. Her work was in response to New York State announcing the emergence of toxic chemicals like PCBs and DDT and other horrible sounding acronym toxins that had simply been dumped by a General Motors plant into a massive native watershed. Cook has been cited saying that women are the first environment. Toxic chemicals get stored in the body, they get stored in fat, in breast milk as well. And the government was doing a disservice to different Indigenous people and also unborn babies by not working harder to resolve this issue. The Mother's Milk Project continues to advocate today for both the earth and for future generations, still urging various state departments, including those in the Great Lakes, to actually regulate their waterside industries. Now, finally, I focus on Winona LaDuke and her organization, Honor the Earth. Some of you might know Winona LaDuke as Ralph Nader's running mate in the 1996 and 2000 presidential elections. She's a huge figure within the Green Party and Indigenous environmentalism. She's been involved in leading legal battles against the degradation of native lands for quite some time now. Her first one started when she was a high school principal on a reservation, and Honor the Earth has done a great job of empowering other grassroots activists. They're based in Minnesota near Lake Superior, and they lead regional workshops. They use tribal media to convey a public interest in culture, and they've provided over $2 million to other small organizations. I should note that if you look up Honor the Earth, there are some ongoing internal legal issues, but I would be remiss to not note their impressive statistics and their contributions to other organizations. Their mission statement notes giving a platform to unheard voices, and I absolutely love that because in researching historical endeavors to combat environmental and public health injustices, we hear individuals and we hear organizations echoing loudly against this chamber of struggles. Being loud and relentless are key aspects of grassroots organizations in fighting systemic change. We can trace this back to really any community level initiative. I'm reminded of Flint, Michigan, fighting the Michigan state government to improve their drinking water. I'm reminded of community members in East Palestine, Ohio, urging their ignorant local government to investigate a biochemical train crash. I'm drawn all the way back to Lois Gibbs, who established the Superfund Act in the 1990s to ensure that her son's elementary school was not sitting on top of mounds of toxic waste. There's a truly beautiful collective power to communities, and there's a responsibility of the government to listen to their people. So just to wrap up and emphasize some takeaways, I really can't stress enough the power that grassroots movements, and especially those led by women, have in amplifying the perspectives of marginalized communities. Governments trying to apply top-down solutions don't always fully comprehend the unique perspectives of community members because they don't live in those areas. That's why top-down solutions really aren't always broadly applicable to smaller regions, and continued collaboration between small groups and legislation is so necessary right now. those of us who are interested in grassroots, can set a precedent that rises from the local level up to a national one and then a global arena, taking into account the special perspectives of those who go ignored much too frequently. So I just want to say thank you to all of you for listening to me today. These are my references. I'm really honored to have had the opportunity to present for all of you, and I'm happy to answer any questions you may have at this time.
Thank you very, very much, Alessandra. There's one question here in the chat, which says, amazing presentation, thank you. Has feminism affected grassroots movement and outreach?
Has it affected it? I certainly think so. I think that it's so important to see women rising up and taking heed of these different organizations. I think that there's, especially throughout the 70s and the 80s, a special emphasis on this connection between environmentalism and reproductive justice that you saw with Gudsy Cook, that the Women of All Red Nations organizations tried to combat, as uranium mining also had an impact on reproductive systems. I think that feminism allows women, but it really empowers all people of all genders, of all backgrounds, to come together and try to fight systemic change.
I think, or another thing, how can we, let me open the chat up here. How can we translate the success of grassroots movements to more effective action at a global level in the effort against climate change? And then the second question too, we'll do them both together. Do you see any connection between your groups and Rene Dubos's global local notions?
So to start with the first question, I'm honestly not 100% sure, because the issue with climate change is that we often try to tackle it from a national or an international level. So we can think about the Montreal Protocol, the Kyoto Protocol. Montreal was effective, but a lot of times these different like international structures simply don't work because different countries have different legislative processes. They have different interests in promoting certain industries. So I think that the key aspect right here is asserting that there's more representation put on different communities, and especially marginalized groups. So hearing all voices and all perspectives, especially what's needed in underfunded areas or areas that have denser minority populations, is incredibly important. There's really no standardized way to do it. I think that the key aspect right here is amplifying the voices of people who often, as I said at the end of my presentation, go unheard. As for the second question, I'm not aware of Rene Dubos's global or local notions, but I'll definitely keep a note of it and look into other sorts of grassroots or systemic change fighters.
I'll throw one other bone into your soup for this. The Puppet Theater of Vermont. Look it up. You'll see. Thank you very much. Now for our closing essayist, and this has been so far a remarkable evening, and it's even going to get better, is Meghana Portrue, whose contribution is Harvest of Despair, Unraveling the Thread of the Great Madras Famine. And Ms. Portrue is a medical student in Galveston. She's taken a long walk to get here tonight. We're all yours.
Thank you so much for your introduction. So hello, everyone. Thank you so much for being here. My name is Meghana Portrue, and I am a medical student at the University of Texas Medical Branch in Galveston, Texas. Today we travel back in time to 1876 to a vibrant region in southern India known as the Madras Presidency. This region encompasses the parts of present-day Andhra Pradesh, Telangana, Karnataka, and Tamil Nadu. So the southern region right around here. And this area was once known for its fertile lands, bustling trade, and rich cultural heritage. At this time, a sense of change and progress was in the air, but beneath this hopeful surface, a silent threat was emerging. A relentless drought fueled by a distant phenomenon that we now know is called an El Niño was brewing. This devastating force would soon unleash its fury, which triggered the Great Madras Famine, a tragedy that would leave an indelible mark on history. Today, we delve into the heart of this forgotten chapter. We'll explore the factors that triggered the famine, the immense suffering it caused, and the crucial lessons it offers for navigating the challenges of our own time. As the drought tightened its grip on the Madras presidency, a complex tapestry of factors began to unravel, each thread contributing to the devastating consequences of the Great Famine. On this slide, we see the three key threads that intertwined to exacerbate the crisis: nature's fury, colonial indifference, and social inequalities. The relentless drought fueled by the El Niño stood as a primary trigger. Imagine parched lands, failed crops, and dwindling water sources, a stark contrast to the region's former prosperity. With colonial indifference, the colonial administration's policies and actions, or lack thereof, significantly worsened the situation. We will explore these policies in detail in the next slide, but for now, remember this thread as a crucial factor in the unfolding tragedy. Lastly, we have social inequalities. The existing social hierarchies and discriminatory practices deeply impacted individuals and communities in how they experienced the famine. We will delve into these inequalities in a dedicated slide highlighting their devastating consequences. Now, let's begin unraveling the first thread, the immense power of nature's wrath that set the stage for this human catastrophe. The primary culprit, as I mentioned earlier, was the El Niño phenomenon, which disrupted weather patterns and led to scant rainfall across the Madras presidency for several consecutive years. This resulted in widespread drought, agricultural collapse, and displacement and migration. The region's agricultural backbone was severely compromised, which led to food shortages and rising prices. In addition to this, in desperate search for food and water, people were forced to leave their homes, which further exacerbated their vulnerability. While nature unleashed its fury, the human response to this crisis would also play a significant role in shaping its devastating consequences and perpetuating the misery that it caused. On this next slide, on the left right here, you see a showcase of the grains that were being shipped out of Madras, but a closer look reveals a harsh reality: colonial priorities clashing with the desperate needs of the population during this famine. Despite the abundance of grain leaving the shores, people grappled with hunger and starvation in India. This paradox raised critical questions about the actions of the British Raj during this time. The concept of colonial indifference refers to these policies of the British government that increased the suffering caused by the drought. At this time, the colonial presence in India was under the Viceroy Lord Lytton. The British government prioritized generating revenue through exports even amidst the famine. This decision was driven by economic interests and came at the cost of human lives. In July of 1877, the House of Commons passed a resolution that recommended the Indian government to either reduce or abolish import and export duties. This resolution served the economic interests of Britain, but disregarded the poor financial situation and condition of India during this time that was caused by the famine. Lord Lytton accepted this resolution and eliminated import duties on 29 items. However, this decision did not satisfy British textile manufacturers, who further pushed for the abolition of duties on coarser types of imported cotton later in 1879. This move further sacrificed India's economic interests and made Lytton an easy tool for Britain to increase its economic exploitation of India. Additionally, the colonial administration's relief efforts were demonstrably inadequate and delayed. This resulted in limited access to food and aid for the most vulnerable populations, which further worsened the crisis. One of the main relief programs involved was a public works program that was intended to provide employment and income for those that were affected by the famine. However, these were very poorly organized and minimally impacted the alleviation of hunger and poverty. On the right side, we see an excerpt from a letter to Lord Salisbury who was back in England in July of 1877. And the viceroy gave his opinion on the state of the Madras region and the relief programs, which he reported as having no organized system and a seriously inadequate staff. There were also issues with the colonial government's grain distribution system. It was criticized for being inefficient and poorly targeted. Delays in transportation, bureaucratic hurdles, and corruption hampered effective distribution, which led to food shortages in certain regions despite there being available grain stock. The Famine Relief Fund, which was established through public donations and taxation, faced accusations of mismanagement and misuse. Concerns also arose regarding the allocation of funds, with some reports suggesting prioritization of administrative costs over actual direct relief efforts. These policies not only failed to alleviate the suffering, but arguably contributed to it, leaving a lasting stain on the colonial legacy in India. While these policies played a significant role, it's crucial to remember that social inequalities within Indian society also deeply impacted the experience of the famine, as we will explore next. With social inequality, there's a few different points that come under this umbrella. Firstly, economic disparities. The famine disproportionately affected the poor and marginalized sections of society. Landless laborers, small farmers, and artisans were particularly vulnerable due to their limited access to resources and lack of economic security. The economic inequalities that were prevalent in society meant that those who were already impoverished were less able to cope with the sudden food shortages and the extreme price hikes. Additionally, the caste system, which was prevalent in Indian society, compounded the effects of the famine. Dalits, which were formerly known as the untouchables, and lower caste groups faced discrimination and exclusion, making it even more difficult for them to access relief measures and resources. Upper caste landowners often held significant power and influence, which further exacerbated the inequalities experienced by marginalized communities. Additionally, access to the relief measures that I discussed in the previous slides were inadequate and poorly managed. The distribution of the relief supplies often favored the wealthy individuals and those that were politically connected, leaving many individuals and communities without sufficient assistance. Corruption and favoritism meant that those with social and economic privilege were more likely to have access to these relief resources, while the most marginalized groups continued to suffer. Lastly, women and children were among the most vulnerable groups during the famine. Social norms and gender inequalities meant that women often had limited autonomy and access to resources, making it difficult to provide for themselves and their families. Additionally, malnutrition and disease had a severe impact on maternal and child health, which further perpetuated the cycles of poverty and suffering. As the famine unfolded, voices within the colonial administration and the media began to challenge the narrative that the British government was operating under. On this next slide, we'll go into some pictures, and I just wanted to provide a trigger warning as some of the pictures can be considered as graphic. So during this time, Dr. William Robert Cornish, the Sanitary Commissioner of Madras, recognized the limitations of words in conveying the true extent of the suffering that was happening. He argued for the power of photography, stating words could at best feebly represent the actual facts. Similarly, a special correspondent for the Friend of India echoed this sentiment, highlighting the need to document the famine visually for the English public. These calls for visual documentation eventually led to the involvement of Willoughby Wallace Hooper, a British military officer and amateur photographer that was serving in the region. While not a professional photographer, Hooper had previously contributed to the People of India project, documenting various communities across the country. However, his motivation and approach to photographing the famine remained debated. His photographs, some were even published in the Graphic magazine, played a role in visually representing the famine to a wider audience. Almost all the pictures I had in the previous slides as well were taken by Hooper. The call for visual documentation and the subsequent circulation of Hooper's photographs while raising ethical questions highlight the complex role of photography in capturing and representing historical tragedies. His photographs endure as a poignant reminder of the social inequalities laid bare during the Madras famine. As we reflect on this history, we're reminded of the ethical responsibilities inherent in documenting human suffering and the ongoing struggles against social justice. The Great Madras Famine stands as a stark reminder of the immense human cost of unforeseen disaster and shortcomings in preparedness. While we cannot rewrite history, its echoes offer valuable lessons for building a more resilient and equitable future. On this final slide, we explore 3 key themes that emerge from this historical tragedy, serving as crucial areas for focus as we move forward. The first one being early warning and preparedness. Investing in early warning system. By proactively monitoring for droughts and other potential threats to food security, we can gain valuable lead time to prepare and mitigate their impact. Additionally, effective communication systems can allow for timely dissemination of warnings to vulnerable communities, empowering them to take necessary precautions, and this can be equally crucial as well. As for sustainable agriculture and food security, we can promote crop diversity. Encouraging the use of traditional and locally adapted crops, which are often more resilient to local conditions, can significantly enhance agricultural resilience. Additionally, embracing climate smart practices can allow for investment in sustainable farming methods and collaborating with local farmers who possess invaluable knowledge. These can be essential steps towards building a more robust food system. Lastly, we cannot forget about addressing social inequalities. We must strive to design social safety nets that reach and support all vulnerable populations, regardless of social status or background, to ensure everyone has a fighting chance in the face of adversity. Additionally, advocating for and ensuring universal access to healthcare, education, and food security is fundamental to building a just and equitable society where everyone has the opportunity to thrive. The lessons learned from the Great Madras Famine resonate with the global challenges we still face today, from climate change and food insecurity to social and economic inequalities. By embracing these lessons and working collectively towards these key areas, we can build a future where we are better prepared to face crises and ensure a more sustainable and just world for all. Thank you so much for your time, and I'm happy to take any questions.
Thank you very much, Banana. There are no questions in the chat. I would ask a question. The photographs that you showed in your third to last slide are profound. Have these been published elsewhere?
Yes, they have. I think a lot of these pictures are the only documentation of the famine. So these are, honestly, you could almost say the only proof of the actual suffering and the extent of the suffering that occurred. So they are published in many other articles that discuss the famine, research reports, to kind of really show and analyze the extent of the suffering that was experienced.
Oh, there's a question in the chat. What are the conditions today in the area affected by the Madras famine?
So a lot of the areas that are affected have there's a lot of agricultural regions, but there's also major cities that have developed that are well into, have their technological advancements and stuff. But there is also research coming out about the effects of the famine on the actual health of those in that region. And so this famine, there was famine in this Madras region. There's also famine in the Bengal region and as well as northern India. So it was very widespread during the British involvement and the colonial era in India. And so though technologically right now India has been advancing, there are still lasting impacts of the famine on the genetics of the people in the region, as well as the health. But yeah.
There's a statement in the chat. The bottom left photograph, this is by Lindsay O'Brien, is featured on the cover of the book Late Victorian Holocaust by Mike Davis. I assume you may be familiar with it.
Yeah, thank you so much for pointing that out. I'll definitely take a look into that.
In conclusion, I would like to thank our panelists, especially the students, who've done a wonderful job of presenting excellent information. The concept of health and the environment, which is a leading concept of the Academy, certainly was its importance in world health and the health of individuals have been emphasized by our 5 panelists. Really, it's just a privilege to hear this. We have about 60 people on the call, and I would like to thank each and every one of you. Also, the sessions are not really over because we had so many good submissions. We have a second session, which will be on Wednesday, the 19th of March. So stay tuned and join us in a couple of weeks, the 19th of March, for our second session. And with that, thank you all. Thank New York Academy of Medicine for supplying the resources to make all this possible. That is really quite a contribution they make. With all of that, good night and have a pleasant week.